Stop everything you are doing right now, because what I am about to tell you in the next few minutes could literally save your life or the life of someone you love. There is a virus spreading across the United States and across parts of the world right now that most doctors are not talking about in their waiting rooms, that most news channels are barely covering, and that is quietly sending people, especially adults over the age of 60, into intensive care units with almost no warning at all. It is called the Hantavirus, and today I am going to tell you exactly what it is, how it gets into your body, what it does once it is inside you, and most importantly, what every single adult over 60 must do this week to protect themselves and their families. If you are new to this channel, I am a physician, researcher, and the author of work that has been cited in leading medical institutions across the country. I have spent decades studying how diseases affect the aging body differently from younger bodies, and what I am about to share with you today is urgent. According to data published by the Centers for Disease Control and Prevention, the case fatality rate of the most dangerous form of hantavirus, a condition called Hantavirus Pulmonary Syndrome, sits between 38 and 50%. That means nearly 1 in 2 people who develop the severe lung form of this disease do not survive it. And here is the part they are not telling you loudly enough. Adults over the age of 60, whose immune systems have naturally declined by up to 60% compared to a healthy 30-year-old, are among the most vulnerable people on Earth to this virus right now. Before we dive in, I want to ask you something very important. Have you cleaned out a garage recently? A shed? An attic? A storage room? Have you swept up dust in an old cabin, basement, barn, or even behind a refrigerator where mice may have been hiding? If the answer is yes, then what I am about to explain could be one of the most important health warnings you hear this year, because this virus does not spread the way most people think. It is not usually spread from casual contact. It is not something you necessarily catch from another person standing near you. Instead, hantavirus is most commonly spread through tiny particles from rodent urine, droppings, or saliva that become airborne and enter your lungs when you breathe. Let me say that again slowly, because this matters. You do not have to touch a mouse. You do not have to get bitten. You may never even see the rodent. All it takes is breathing in contaminated dust particles while cleaning an enclosed area. That is it. And for older adults, that exposure can become deadly very quickly. Now, I want you to picture this. A retired couple decides to clean out their lake house before summer. The windows have been closed for months. There are a few mouse droppings in the corner, but they think nothing of it. One of them grabs a broom and starts sweeping. Dust rises into the air. Within 1 to 5 weeks, one of them begins feeling tired, maybe a mild fever, muscle aches, a headache, nothing dramatic. They assume it is a cold, the flu, or maybe simple exhaustion. But then suddenly, almost overnight, breathing becomes difficult. The lungs begin filling with fluid, oxygen levels crash, and within hours, they are in the emergency room fighting for their life. This is not fear-mongering. This is exactly how Hantavirus Pulmonary Syndrome often begins. And here is one of the most dangerous parts. The early symptoms look almost identical to common illnesses. That means many people ignore the warning signs until the disease becomes critical. So today, I want to walk you through the stages carefully, because recognizing the symptoms early could save precious time. The first stage often feels deceptively mild. You may experience fever chills, muscle pain, especially in the thighs, hips, and back, fatigue, nausea, vomiting, dizziness, headaches. Some people also experience stomach pain or diarrhea. Now here is where seniors must pay close attention. As we age, the immune system becomes slower and less efficient. Doctors sometimes call this immune senescence, which simply means the body's defense system weakens with age. That means older adults may not respond to infections in predictable ways. A fever may not be very high. Symptoms may seem subtle. You may simply feel off. Did you know many older adults hospitalized with severe infections initially thought they were just dehydrated or tired? That is why paying attention to unusual fatigue is so important after any possible rodent exposure. Then comes the dangerous phase. This is when the virus attacks the lungs. And this is the moment where everything can change in a matter of hours. People suddenly experience shortness of breath, tightness in the chest, rapid heartbeat, severe coughing, extreme weakness, blue lips or fingertips from low oxygen. At this point, the lungs begin leaking fluid. Imagine trying to breathe through a sponge soaked with water. That is what severe hantavirus infection can feel like. Many patients require intensive care and mechanical ventilation, machines that help force oxygen into the lungs. And unfortunately, some patients do not survive even with advanced treatment. Now here is something else most people do not realize. There is currently no specific antiviral cure for Hantavirus Pulmonary Syndrome. Let that sink in. No miracle pill. No guaranteed treatment. Doctors mainly provide supportive care, oxygen, fluids, breathing support, and intensive monitoring while hoping the body can fight the infection. That is why prevention is everything. And the good news is this. There are clear, practical steps you can take today to dramatically reduce your risk. In fact, I strongly encourage every adult over 60 watching this video to write these down. Number 1. Never sweep or vacuum rodent droppings. This is one of the biggest mistakes people make. Sweeping or vacuuming can launch contaminated particles into the air, where they can easily be inhaled. Instead, experts recommend spraying the area with a disinfectant or a bleach solution first. Let it soak for at least 5 minutes. Then use paper towels while wearing gloves to carefully remove the material. Place everything into a sealed plastic bag before disposing of it. This simple step alone may significantly reduce airborne exposure. Number 2. Ventilate enclosed spaces before entering. If a garage, cabin, shed, or attic has been closed for a long time, open the doors and windows for at least 30 minutes before cleaning. Fresh air can help disperse potentially contaminated particles. And if possible, avoid being the person who cleans heavily infested areas if you are older or have chronic health conditions. Here is a secret most seniors do not know. People with heart disease, diabetes, lung disease, or weakened immune systems may face an even harder battle if they become infected. Conditions like COPD, emphysema, asthma, or congestive heart failure already place stress on the lungs. Adding a severe viral lung infection on top of that can overwhelm the body quickly. Number 3. Seal entry points in your home. Mice can squeeze through holes as small as a dime. Take a careful walk around your home. Check under sinks. Look behind appliances. Inspect garages, crawl spaces, and attic openings. Seal cracks using steel wool, caulk, or proper repair materials. Even small prevention efforts can dramatically reduce rodent activity. Number 4. Store food properly. Rodents are constantly searching for food sources. Pet food, birdseed, cereal boxes, and even crumbs can attract them. Use sealed containers whenever possible, and do not forget about outdoor storage areas. Many infestations begin in sheds or garages where food supplies are left exposed. Now let me pause here and tell you something deeply important. The goal of this video is not to make you afraid. The goal is to make you aware. Fear without action helps nobody, but knowledge combined with prevention can save lives. And older adults deserve clear, direct health information because your body processes infections differently than it did decades ago. Unfortunately, many seniors underestimate how quickly respiratory infections can become dangerous. Did you know lung capacity naturally decreases with age? By the time many people reach their 70s, the lungs are less elastic, and the muscles involved in breathing are weaker than they were in middle age. That means infections affecting oxygen levels can become critical faster. This is one reason doctors take pneumonia so seriously in older adults. And hantavirus can be even more aggressive. Now, there is another question many viewers may be asking. Where exactly is hantavirus found? The answer may surprise you. Cases have been reported across many regions of the United States, particularly in rural areas where rodent exposure is more common. The deer mouse is one of the primary carriers in North America. And despite its harmless appearance, this small rodent can carry dangerous viral particles. You cannot tell by looking at a mouse whether it carries hantavirus. That is why all rodent droppings should be treated seriously, and it is not only cabins or farms where risk exists. Urban homes, storage units, old buildings, campers, trailers, and vacation properties can all become contaminated. Here is another important point. Many infections occur during seasonal cleaning. Spring and early summer often bring increased exposure because people begin opening cabins, garages, and sheds that have remained closed all winter. But exposure can happen year-round. That means this is not something to think about once and forget. It requires ongoing awareness. Now let us talk about one of the biggest misconceptions. Some people believe that if they feel healthy overall, they are not at risk. That is not true. Even healthy adults have become critically ill from hantavirus. However, aging bodies have less physiological reserve. That means the body has less backup capacity to handle sudden stress. Think of it like an old car engine. It may still run well, but when placed under extreme pressure, it has less room for error than a newer engine. The same principle applies to the heart, lungs, kidneys, and immune system. Now I want to explain something else in simple terms. When severe hantavirus infection develops, the immune system can overreact. Instead of only attacking the virus, the body creates widespread inflammation. Inflammation is the body's emergency response system, but too much inflammation can damage healthy tissues. In the lungs, this can cause fluid leakage into the tiny air sacs responsible for oxygen exchange. That is why patients suddenly struggle to breathe. And this is also why rapid medical care matters. If you or someone you know develops flu-like symptoms after rodent exposure, especially breathing problems, do not wait it out. Do not assume it will pass. Seek medical attention immediately and tell healthcare providers about the possible rodent exposure. That information could help doctors recognize the illness sooner, and early recognition can improve the chances of survival. Now, I know some people watching may feel overwhelmed. You may be thinking, I have cleaned dusty places my whole life and never got sick. And that may be true, but risk is not the same as certainty. Many dangerous conditions are rare until they happen. Seatbelts save lives even though most car rides end safely. Smoke detectors matter even though most houses never catch fire. Prevention works because it reduces the odds of tragedy. And when a disease carries a fatality rate approaching 40 to 50%, even relatively uncommon risks deserve attention. Now let me share a practical cleaning checklist every older adult should remember. Before cleaning any area with possible rodent activity, open windows and doors. Leave the space for at least 30 minutes if possible. Wear disposable gloves. Use disinfectant spray or diluted bleach. Avoid sweeping or vacuuming dry droppings. Use paper towels for cleanup. Wash hands thoroughly afterward. Disinfectant, reusable tools. Wash clothing exposed during cleanup. And here is another tip many people overlook. If you find a dead rodent, never pick it up with bare hands. Spray it first with disinfectant. Use gloves. Place it into a sealed bag. Then wash your hands carefully. Simple habits matter. Small actions prevent big problems. Now, I also want to speak directly to adult children watching this video. If your parents are older and still doing physically demanding cleanup projects alone, please check on them. Many seniors are fiercely independent. They do not want help. But tasks involving attics, basements, barns, sheds, and storage units may expose them to unnecessary risk. Sometimes the safest decision is hiring professionals for heavily contaminated spaces, especially if there is visible rodent infestation. Did you know stress and exhaustion can also weaken immune defenses? Many older adults push themselves too hard during home projects. They skip meals, forget to hydrate, overexert themselves. All of that places additional strain on the body. So if you are planning major cleaning projects, pace yourself, take breaks, drink water, wear proper protection, and never ignore unusual symptoms afterward. Now let us address another concern. Can hantavirus spread from person to person? In most North American strains, person-to-person spread is considered extremely rare or not typical. Most infections come directly from rodent exposure. That means the primary focus should be environmental prevention. Keeping rodents out of living spaces matters enormously. Now, some viewers may wonder whether masks help. The answer is yes, especially during cleanup of dusty enclosed spaces. A properly fitted respirator mask, such as an N95 mask, can help reduce inhalation of harmful particles. But masks should never replace proper ventilation and disinfection. Protection works best when multiple safety steps are combined. Think of it like layers of defense: ventilation, disinfection, gloves, masks, careful cleanup. Together, these strategies create much stronger protection. Now let me tell you something hopeful. Most hantavirus infections can likely be prevented through awareness and proper cleaning methods. That means knowledge is powerful. The problem is that many people simply do not know the danger exists, especially older adults living in rural areas or maintaining vacation properties. And unfortunately, by the time severe breathing symptoms appear, the illness may already be advanced. That is why conversations like this matter. Now, I want you to imagine two different scenarios. In the first scenario, someone rushes into an old shed and immediately starts sweeping mouse droppings. No ventilation, no gloves, no mask, no disinfectant. They unknowingly inhale contaminated particles. In the second scenario, someone opens the doors first, lets fresh air circulate, uses gloves, disinfectant, and careful cleaning methods. The difference between those two situations may seem small, but from a medical standpoint, the difference could be enormous. And this is exactly why education saves lives. Now, let us talk briefly about warning signs that require urgent medical attention. Please do not ignore difficulty breathing, chest pain or pressure, severe weakness, blue lips or fingertips, confusion, rapid worsening after flu-like symptoms, especially if there has been recent exposure to rodents or contaminated environments. Older adults can deteriorate very quickly once oxygen levels begin dropping. Minutes and hours matter. And here is something else important. Do not feel embarrassed to mention rodent exposure to your doctor. Some people leave out details because they think it sounds unimportant. But environmental exposure history can provide critical clues. Doctors cannot connect the dots if they do not know the full picture. Now, I also want to discuss emotional health for a moment. Stories about dangerous viruses can understandably create anxiety, but anxiety becomes harmful only when it paralyzes action. The healthiest response is calm preparedness. Learn the facts, take precautions, stay informed, and focus on practical safety habits rather than panic. That approach protects both physical and mental health. And remember this, the purpose of awareness is empowerment, not fear. Empowerment. Now, there is one final message I want every person over 60 to hear clearly. Your age does not make you weak, but it does mean your body deserves smarter protection. The immune system changes with time. The lungs become more vulnerable. Recovery often takes longer. That is not failure. That is biology. And wise prevention becomes more valuable with every decade of life. So please do not dismiss this information. Share it with your spouse, your neighbors, your friends, your parents, your adult children. Because someone you know may be planning to clean out a garage, shed, cabin, attic, basement, or camper this very week. And one simple precaution could make all the difference. Before we finish, let me quickly summarize the most important takeaways. Hantavirus is a potentially deadly virus spread primarily through airborne particles from rodent urine, saliva, and droppings. Older adults face higher risks because aging weakens immune and lung function. Early symptoms may resemble the flu, but severe breathing problems can develop rapidly. There is no guaranteed cure. Prevention is critical. Never sweep or vacuum rodent droppings. Ventilate enclosed spaces. Use disinfectants, gloves, and masks. Seal rodent entry points. And seek immediate medical care for breathing symptoms after possible exposure. Most importantly, remember this. Small habits save lives. The simple decision to clean safely today may protect your future tomorrow. Thank you for spending this time with me. If this information helped you, please share this video with someone over the age of 60. You never know whose life it may protect. Stay informed, stay careful, and take good care of your health and the people you love.